Okay. Well, thank you for joining us for today's Lunch and Learn. Today we're going to be talking about Family Resource Center, and before that, we just have a few Wisconsin updates we wanted to share first, and then we'll um, kick it off to our guest speakers today. So I'll pass it to Liz. Oops.
Hi, yes, just a few quick updates for Reach Out and Read Wisconsin. We wanted to say welcome to Mandy Reeve, our new program director. She is potentially going to call in as she is driving to Sparta for a clinic visit with one of our program directors. But she started in early July, and we're really excited to have her on board. Just want to talk a little bit about progress reports. They are due September 1, but if you get them in by this Friday, which is tomorrow, crazy, you do get to have a chance to win $100 worth of books. If they haven't, your program managers will be talking to you about site visit enhancements. So that is upcoming. Information about that also is in our clinic newsletter last month, and it'll be in our clinic newsletter this month. And lastly, if you haven't registered for our annual meeting on October 24th, please do so. That also will be in our clinic newsletter that goes out Wednesday. And it is at Epic headquarters, and so it will be very epic, and we're excited about it. I think that is it for Wisconsin updates. Sandy, off to you.
All right. Well, thank you. I want to welcome Rebecca and Marilyn for taking your time today to talk with us about Family Resource Center. Rebecca has been with the executive director of the Child Abuse and Neglect Prevention Board and Celebrate Children Foundation since 2020. Oops, sorry. And the Prevention Board is a state entity dedicated to preventing child abuse and neglect and strengthening families across Wisconsin. The Prevention Board provides funding to community partners for parenting support, education, and access to family resource centers that are proven to reduce risk and build resilience. Marilyn Huckenpoehler has been the director of primary prevention programs since 2012 with a Parenting Place, a family resource center serving families in La Crosse, Monroe, Vernon Counties since 1990. And I'll kick it off to you guys.
Great. Thank you so much for inviting us to the Lunch and Learn. We appreciate the partnership and the collaboration. The Prevention Board, as Sandy gave in our bio, we're a state entity. We were set up in statute in 1983 for the purpose of primary prevention. The founding legislators really wanted something that helped parents learn about parenting, how to build a relationship between parent and child early on to mitigate any other issues that would come on, and then making sure parents knew there was a safe place where they could go and get help. So really working for us, we ground everything in the strengthening families protective factors. Those 5 known characteristics that all families have, and much like muscles, when you get to work them, they become stronger. And that is not just for reducing abuse and neglect, right? Because we don't want to just have kids that aren't abused and neglect. We really want to strengthen our families and have kids that thrive. So we fund out into communities and mainly family resource centers, but not exclusively family resource centers. And right now we've been working with Reach Out and Read for about a year, maybe even a little over a year, on a pilot in parent cafes around reading roots, really bringing together those protective factors and early literacy. But I'm just kind of the opener. Marilyn's the main show. There's nobody that can tell you about family resource centers other than one of our family resource centers. So Marilyn's from the La Crosse area. They are a long-standing family resource center. They are an accredited family resource center of quality in Wisconsin, and also are participating in this pilot. And I'll turn it over to you, Marilyn.
Thanks, Rebecca, and thank you everyone for inviting us here. It's always exciting to talk both about family resource centers and about parent cafes. So as it's been mentioned already, the Parenting Place has been around since 1990. We are one of the 14 accredited family resource center of qualities in Wisconsin, which means that our administration and our parent educators have really worked through a high bar in terms of background and training and systems that really deliver quality services to families. So we're very proud of that. Here at the Parenting Place, our support and education for families is aimed primarily at the 0 to 5 set of families, parents or caregivers with that age group, but we certainly stretch into areas of support and education for older children as well. But those programs are really built on a spectrum so that parents can find sort of the just-in-time service that really meets their needs as they define it. It's very parent-driven, it's very voluntary, but it is a free opportunity to build those 5 strengths or the protective factors as we talk about. And we really emphasize that idea of universal access, that all families and all communities benefit when we increase anyone's protective factors. So we have play groups, parent support groups, parenting classes, individual parent coaching, and then of course, parent cafes. So with our parent cafes, which we've been offering on and off since 2015, always very popular with families. It's one of our most requested programs. And families just really relax and lean into that opportunity to have conversations with other parents. And they walk away just saying, oh, I realize I'm not alone in my parenting joys or my parenting struggles. And they really get tips from each other about how to handle the day-to-day challenges. So folks always really love the cafe opportunity, and that format just really dovetails nicely with the 5 strengths emphasis of our parent cafes and this new Reading Roots Cafe, because they've really crosswalked it quite nicely. So our parent population already recognizes that 5 protective factors language, and the idea of then embedding that in how they use books in their family and reading with their child was a pretty easy leap. So we piloted our first cafe last week with a small population of parents and parent leaders. And we really were pleased with how it rolled out in terms of parents really jumped in quickly to these conversations about how do we just do even small doses? We don't have to reinvent the wheel for our family. How do we just make small ways to insert reading into family routines? And how do we use that reading in small ways to build protective factors with our family? So they had lots of ideas about how to find new books to keep things fresh or to help a child work through a particular emotional concern. They had tips about um, where to find those books, or even discussion that kind of deepened into what makes children's literature a quality piece of literature. They talked about their boys rushing for kind of the latest cartoon character. My daughter's 23, so I don't know the rage anymore in terms of what's popular. But parents talked about, kind of boys always want to grab the book with I guess what I would call this generation's Transformer or whatever it is on it. And then talking about how do you honor that child's choice in what their book was, but also use it as that opportunity to talk about protective factors. And if that machine or that inanimate object that's been kind of humanized is struggling with loneliness or not being included with others, still a great opportunity to use that as a way to talk about that protective factor of social connections and understanding emotions, or whatever was the protective factor that they wanted to work on. And they also talked about, some classics that they remembered from their childhood that had an impact on them and helped them make sense of their world. So it was really neat to see in 1 hour's time how parents could come together and really move into that slower, deeper conversation of how children's books can really shape and help a child navigate some of those common concerns. And at the end, we handed out a brochure or a tip sheet, happened to have the Reach Out and Read logo. I was really stunned. Like I said, my daughter's 23. I'm kind of out of the pediatrics family practice world when it comes to doctor visits, but they all were like, oh, reach out and read. Got this book from my pediatrician. So that recognition is there. And it was really neat to be able to kind of bridge those two elements of a parent's world, and certainly gave our staff and our administration an opportunity to talk afterwards about how we might build on that to partner with our local practices, so that when they're giving out those books, we can supplement with, here's the next 3 scheduled reach out and read based cafes. You can kind of plug in with what you just heard from your child's doctor and use that as a way to connect with that parenting and support. So I'm real optimistic about the impact that this can have in our communities, and really excited about this work that we've embarked on together.
Great. And I'm just going to kind of ask a couple of questions because Family Resource Centers, Marilyn did a good job of explaining like the parenting supports in this part of this pilot, but they're more than just that. So in that kind of accreditation process, right, we have parenting supports, child development activities, resources and navigation. They work on parent leadership and community engagement. So one thing that we found working with a specific health system is that their call center, or sometimes at the end of those well baby visits, well child visits, parents are asking for very specific things. They're asking for diapers, maybe a car seat because their kid is grown. They're asking for some help on transportation, things that sometimes are outside of the medical realm, but your trusted nurse or pediatrician is where they may ask for those. And those are also things that the majority of our FRCs, our Family Resource Centers, have. Specifically in La Crosse, the parenting place is also part of a diaper bank, and also provides other concrete supports to help. So being able to find our Family Resource Centers across the state, I also think is a helpful resource for the medical community when families are asking for additional things. Marilyn, did you want to add any more to that aspect?
Yes. So, for us locally, our staff are really versed in Great Rivers 211, as I'm sure our pediatricians and family practices and nurses are. But our staff have that time to help parents, walk through that. So we may not provide the resource in-house, but our staff are really versed in how to have those conversations, how to make the phone calls and navigate systems. And so we are there to help parents find those concrete supports. I will add that in particular, our Family Resource Center in La Crosse also has programs beyond that universal access parent education and support. So we offer things like the Birth to 3 program, the direct service for that. And then we're also associated with some of our county programs. So children's long-term support waiver programs and those things that, again, can help families deal with situations that are unique to them. It might not be necessarily a tangible support like housing or diapers. It might be more navigating that world of mental health or other support services. So really an accessible and easy way for parents to tap into those things.
Thank you. And just again, there are about 40 FRCs across the state, and as Marilyn said, we have 14 that are FRCs of quality, with more Family Resource Centers signing up every day. We do have a couple of them that are also their Head Start in their community. They may also be connected to a community action agency. And then we do have a couple that are connected to other larger systems. So as Marilyn said, they're part of their county services, right? Birth to 3 is right there. Children's long-term waiver. We have some that are connected directly into the school system, even though they still focus on that 0 to 5 space. That also means they can go a little bit into other ages with children in there. So just wanted to kind of give you a little bit more of, you go to one Family Resource Centers, there are some building blocks and some kind of basics that they all have. And then there are differences depending on their community. Because it is a community-driven need, and having that parent voice and parent leadership, that is also going to change a little bit of the programming offerings that they have. Any questions or anything else, Julie or Dee Dee, that you wanted us to kind of get into the nitty-gritty on. We can include a couple of links on how to find the Family Resource Centers, and then our specific 211 page also, which again, Marilyn brought up 211 Rivers. I know they're specific. Sorry, go ahead.
Yeah, I think that's the key piece right there, Rebecca. Those links that we can attach to the webinar and send out to everyone. And we tried our best, we know it's back to school time, and we have some folks here in parts of the state still recovering from flood and families supporting them. So this is another reason why I believe that this is a timely topic as we think about resources for our families that may feel anxious, and we want to continue to support our children and making sure that they get what they need. So I think we want to make sure we get this as a quick turnaround. We have a couple of weeks. Some schools have started, and daycare and all these things that are happening at the same time. We want to make sure we have like a great coordinated message that our clinics can also share.
Oh, it's wonderful. Again, yeah, thanks for inviting us. And transitions are always a time of excitement and anxiety, right? So transitioning from summer, whether that's back to full-time childcare, going back to school, even changing grade level. We know our kiddos might have a lot of big emotions at this time, and parents also may have some anxiety. So it's a perfect time, quite frankly, to find places where you can get some help, but also connect with other parents. I think that that's something, much like Marilyn, my children are young adults. I still call them emerging adults. But, at that time, it feels like a lonely job when you are in the thick of parenting. So something like the parent cafes, the play groups, Pee-wee, parents interacting with infants, which goes into other ages too, even though we say infants. Finding other parents on that same journey also helps you as a parent to grow and feel connected.
Right. So I think, Julie, we have it. Thank you. Yes, and yes. All right, well, then we will gift people their time back, 7 extra minutes. We're going to edit the webinar, add on these links and materials, send that out. We do a monthly clinic newsletter, and then we also put special announcements through our MyRoar platform that we can remind our site coordinators and clinic managers and medical champions to just check out the announcements. Here's some important links, webinars if you missed it. This is great information. And that they can also see you all at our annual meeting, October 24th at the EPIC headquarters.
Looking forward to it. Thank you very much.
Great. Thank you, everyone.
Yeah, thanks everyone for coming.
Thank you all.